Hi Erin, my name's Patty. I'm going to be the nurse practitioner doing your exam today. I see that you're in a gown and you've had an opportunity to empty your bladder. Great. I have your vital signs including blood pressure. I have your height and weight, which look good. And we tested your vision via the Schnellen chart, and we also tested your near vision with the Rosenbaum and Jaeger chart. Excellent. So I'm going to start from head to toe, but as I'm walking in and talking to the patient, I'm going to do a general assessment. I'm going to look at her posture, look at her general appearance, see how she's doing. So I'm going to start with her head. As I'm inspecting the scalp for any abnormalities, any crusting, I'm also going to be palpating for any tenderness. I'm also looking for the hair distribution, any areas of baldness, which you don't have. I'm also going to inspect the face and look at the general appearance. I also want to check for symmetry, looking at the symmetry of the eyes and the level of the pinna. I'm also going to palpate the facial bones for any tenderness or crepitus and the sinuses at the same time. I'm also palpating the sinuses at the same time. I'm going to have you open your mouth as I assess for TMJ. Great. Can you close your eyes for me? Squeeze your eyes shut. Can you wrinkle your forehead? Give me a big smile. And stick out your tongue. And puff out your cheeks. And clench your teeth. Great. I'm also going to do light touch. If you could close your eyes for me and tell me if you feel this.
Mm-hmm.
Yes?
Yes. Yes.
Great. So moving on to the eyes, I'm going to inspect Erin's eyes. For general appearance, I'm looking at the eyebrows and the eyelashes, hair distribution, looking for any crusting of the eyelashes, any lesions draining. I'm also going to look in the conjunctiva and assess for vascular pattern and clarity. I'm going to palpate the lacrimal apparatus, which is the inner orbits from outer to inner. Okay, great. I'm also going to perform a couple of eye exams. I'm going to use this fancy gum package, and we're going to do the uncover test. So if you could please just look at my nose, and I'm going to cover your eye. Okay, great. I'm going to do a couple exams with the light. I'm going to be checking your pupils here. Okay, looking for perla. Then have you look at my nose. Do light reflex. I'm also going to test for accommodation, which if I can have you look at the wall behind me. All right, I'm going to bring this object in, look at the wall behind me, and then I want you to focus on this object. Great. I'm also going to assess for the 6 cardinal fields of gaze, looking at the extraocular eye movements. I'm going to hold her chin, have you follow my pen. Repeat on the other side. Great, and then we're going to do the confrontation test. So if I could have you please cover your right eye and let me know when you see my hands.
I see it. I see it. I see it.
Okay, here I'm also going to do the test for sensation. If you close your eyes and tell me if you feel light or sharp.
Light. Sharp. Light. Sharp. Light. Sharp.
Great. Okay, next I'm going to inspect your ears, and I'm going to I'm going to be looking at the pinna or the auricles, and I'm going to be assessing again for symmetry, any signs of injury or abnormalities. I'm also going to be palpating for any lesions, swelling, tenderness, any nodules. I'm going to do an otoscopic exam. I'm going to take a look in her ears, and as I assess inside her ears, I'm going to be assessing for any exudate, drainage, fluid, and noting any bony landmarks, or noting my bony landmarks. Look in the other ear. Great. I'm also going to do the whisper test. So if you could please repeat after me.
Beer, pretzels, baseball. beer, pretzels, baseball.
Great. And I'll also use my tuning fork to do the Renee test, which is striking the fork, set it on the mastoid bone. Let me know when you can't hear. Okay, and then putting it in front of her ear.
Okay.
Okay. And I would repeat the process on the other side, and air conduction should be twice as long as bone conduction. And then I would do the Weber test, which is placing the tuning fork midline on her forehead. And do you hear equal in both ears?
Yes.
Okay, it should be heard equal in both ears. Moving on to the nose, I'd inspect the nose for midline placement, also assessing the septum in the nostrils, make sure they're equal, patent, no deviated septum. Also take my nasal speculum and my light, look up, assessing for the turbinates, moisture, lesions, any crusting or any obstructions. Here I would also assess the patient's sense of smell, and I would also assess for patency. Could you occlude one nostril and blow out? Occlude the other nostril and blow out? Okay, great. Next we're going to go to the mouth. I'm going to look at the lips. I'm looking for cyanosis, any cracking, dryness. I'm going to have you open your mouth, say ah.
Ah.
Okay, I'm looking at the tonsils, the posterior pharynx, the pillars, basically looking at the general appearance of the mouth, inspecting the teeth for color, alignment, color and alignment. And I'm looking at the tongue. Can you stick your tongue out for me? Great. I'm assessing for moisture, any lesions. Lift your tongue up. Looking at the bottom, looking for any white patches, lesions, any swelling. Great. Now moving on to the neck. Moving on to the neck, I'm just doing a general inspection for the shape of the skin. Does the neck look big? I'm assessing for any JVD. I'm going to palpate her thyroid. Okay, I'm going to have you turn your head to the side for me. Okay, let me find the thyroid and have you swallow. Okay, great. And then I would palpate the carotid pulses one at a time. Great. And then I'm going to have you touch your chin to your chest. Great. Can you tilt your head back as far as it will go? Side to side, side to side. And can you push against my hand? Great. Other side. Great. Also, I'm going to have you shrug your shoulders. Great. So testing your strength. Here I'm going to assess for the lymph nodes. Do my lymph node assessment here. Supraclavicular, clavicular, and then I'm going to also go ahead and do the axillary lymph nodes and the epitrochlear lymph nodes. Okay. And then here with the bell of my stethoscope, I'm going to auscultate the carotid and the thyroid for any bruits. Okay, for the upper extremities, I'm going to have you put your arms out for me. Okay, this is kind of part of a neuro exam, assessing for strength and any drifting. As she's got her arms out, I'm going to assess and palpate at the same time, looking at the condition of the skin, any dryness, any abnormalities. I'm going to look at the nails in the hands. All right, I'm going to have you squeeze my hands. All right, can you push? Great. And pull. Great. And also noting color and temperature. Okay, now we are going to go to the back. Posterior exam, I'm going to assess the back. I'm going to have you turn this way. All right, I'm going to be doing a general inspection of the back. I'm going to assess for the thoracic configuration, noting symmetry of the shoulders and the musculoskeletal development. I'm also going to palpate the costovertebral angle and do blunt percussion. Noting any tenderness, okay? And then I'm gonna here palpate the cervical and lumbar spine for alignment, any tenderness, swelling, any abnormalities. Okay, next I'll move to the lungs. Here I'm going to look at her breathing pattern, her level of comfort. I'm going to assess for expansion. If I could have you take a deep breath in for me and blow it out. Should be even. One more, please. Great. I'm gonna also do tactile firmatives, say 99.
99. 99. 99.
Okay, so I'm also gonna start with percussion, side to side. Okay, and I'll also do the lateral walls while I'm over here. So my favorite part, the diaphragmatic excursion, I'm gonna have you kind of cross your arms in front of your chest and take a deep breath and let it out. And then I'll percuss downward. Okay, grab my piece of tape. Okay, and then I'm gonna, take a breath. Sorry, that took so long. And then I'm gonna have you lean forward, take a deep breath in, and then I'm gonna progress upward. Okay, then I would take a ruler and measure it. And it should be 3 to 5 centimeters, and hers is right at 4. And I would repeat the process on the other side. Then I would go to the lung sounds and I'd assess those and back and forth. 1, 2. Okay, I'm going to assess the lateral side. Okay, and while I'm listening to the lung sounds, I would also assess for agophony, bronchophony, or whispered piliqui. All right, now I'm gonna move to the front. And again, in the front, I assess rate of breathing and just overall appearance of the skin and the configuration of the chest. I would also palpate the chest for any crepitus. You lift your arms for me, please. Thank you. Okay, and let's see here. Next is palpate the precordium for any thrills or heaves. Okay. Oh, I would have inspected for that too. I forgot to mention that. I would inspect for heaves and thrills also. And then I would palpate down the front for tactile firmatives, 99.
99.
99.
99. 99. 99.
Okay. I would listen for apical pulse. Okay, and then I would listen to the heart tones. That's A. Oh, yes, I should turn you around so you can see it. Heart tone would be aortic, tricuspid, herbs. A poor, so it'd be aortic, pulmonic, herbs, which would be a little difficult because of her boobs. A poor, tired, tricuspid, and mitral valve. All right, so we've done with that. Now we go to the belly exam. Okay, the most stressing part about this exam. So for the abdomen, I would assess the abdomen and visualize for contour and any pulsations. I would also auscultate next, and that would be listening in all 4 quadrants and noting after 5 minutes of listening to each quadrant would be known as absent vowel sounds. So now next moving to auscultating the arteries. So I start with the aortic, and then the that's left, and then right renal, right, and then left iliac, and then the femoral arteries, and then here I would also palpate the groin or femoral lymph nodes. Inguinal lymph nodes. Okay, so now moving on to, on the right side. To percussing for the liver border. So for percussing the liver border, I would start on the right mid-clavicular line, and I would start percussing upward from tympany to dullness, and then marking my spot, and then I would start from the top percussing down from tympany to dullness and marking that spot, and that would give liver borders. And you can also do the same process at the mid-sternal line, starting from the bottom up and from the bottom down. For percussing the spleen, I would start over here a little bit past the mid-axillary line and percuss up until I reach an area of dullness, which sounds about right there. And then I would perform light palpation in a systematic fashion. And while I'm doing, oh, there's your aorta. Okay, and then I would start with deep palpation in a system. And while I'm doing the palpation, I would assess for her muscle tone. Okay, and then I need to feel for the liver. So for the liver, I would, underneath the rib cage here. Oops, sorry. Didn't mean to stab you with my fingernails. And then on this side, I would feel for the spleen. Okay, spleen. And then the kidneys. If I could have you take a deep breath for me and then blow it out. Okay. And then on the same thing on the other side. Okay. All right, great. I'll have you sit up, please. Okay. Okay, so now for the feet and lower extremities. Here I would, again, inspect, looking at the general muscle tone, skin condition, any dryness, hair distribution, and Aridin shaver legs, but that's okay. And feeling for any edema, as well as assessing at the same time. You know, while I'm inspecting, I can also palpate and feeling pulses. Okay, and popliteal. Okay, great. And then next I'm going to check the reflexes. I'll start with the uppers here. Ooh, that was a good one. Okay, good. All right, and then the knee. Okay, and then I'm going to do the Achilles. Okay. Okay. And then I'm going to have Erin stand up, please. And then we're going to just do some squats, assessing muscle strength and equalness of side to side. And then I'll have you, if you can put your hands over your head, test the range of motion of the shoulders, big circles. And then I'm going to have you lean forward and touch your toes. And this is assessing, I'm going to look at the curvature of her spine, but it's also assessing the lumbar spine. And if you could lean side to side and then back as far as you can. All right. And I think that's pretty much it. Do you have any questions?
Nope.
Did I leave anything out?
Nope, that's good.
Okay, thank you.
Thank you.
That was a lot of fun, by the way.